No one should have to be a superhero. Cartographic narratives are a form of telling stories about people and places. We have used them in our research project Mapping Underdoctored Areas to share some of the experiences that doctors described to us about their medical training and the choices they felt they had to make about their career paths. We are interested in the relationships between places, medical training pathways, and areas that struggle to recruit and retain a medical workforce. With these narratives, we want to encourage discussion about how underdoctoring is affected by events in doctors' lives. In No One Should Have to Be a Superhero, Tony, the artist we have been working with, is drawing a story that a lot of female doctors told us about their careers. Male doctors also shared the compromises made when wanting to juggle career and family life, but this difficulty came across most strongly in women's narratives. The story starts at medical school, where our character, let's call her Agatha, is excelling at academic work. She dreams of being a surgeon and her hard work pays off, but at a price. It's time to pick the kids up from school, but she's still operating on a patient. The challenges of managing family life alongside a demanding career are familiar to a lot of us, and home life isn't always a break from the stresses of work. Agatha is pretty much a superhero, managing all the pressures and claims on her time. But as she says at the end of her story, for many doctors, this is completely unsustainable and they feel pulled in many directions as they try to support patients, keep skills up to date, and support life outside of the NHS as well as within it. For many of our participants, the compromises they made came at the expense of their career progression, and unlike Agatha, they were not able to go into the speciality they originally planned to. One doctor talked about the way that they felt they had to give up their career when they had a baby. Others spoke of senior doctors sitting them down and telling them stories of how they missed their children's birthday parties for the job and what that meant to them longer term. Our research findings show that there should be more support for doctors to reach their potential and ensure that they can have sustainable careers and a satisfying home life. Nobody should have to be a superhero. And if we want to have a health service staffed by doctors who want to stay in their jobs, we need to work to think about the expectations placed on professionals. Change needs to be a priority, and achieving more sustainable careers for doctors will have positive implications for patients.